Question 1. Regulatory review indicates that a healthcare organization is planning to integrate advanced AI-powered diagnostic tools into its expanding telehealth and remote care services. These tools are designed to analyze patient-submitted data, images, text, and vital signs to provide preliminary diagnoses and treatment recommendations. The organization aims to leverage these capabilities to improve efficiency and patient access. What is the most appropriate initial step to ensure compliance with U.S. federal healthcare information regulations? Option A. Develop and implement comprehensive data governance policies that explicitly address the collection, storage, transmission, and de-identification of patient data used by AI, alongside robust encryption and access control measures, and ensure patient consent processes are updated to reflect AI usage. Option B. Begin integrating the AI tools into existing telehealth workflows, assuming that current HIPAA compliance measures are sufficient for AI-driven data analysis. Option C. Immediately deploy the AI diagnostic tools across all telehealth platforms to capitalize on their advanced capabilities and gather real-world performance data for future optimization. Option D. Prioritize the acquisition of the latest AI hardware and software to ensure the most advanced diagnostic capabilities are available to remote care providers. Correct answer is A. Develop and implement comprehensive data governance policies that explicitly address the collection, storage, transmission, and de-identification of patient data used by AI, alongside robust encryption and access control measures, and ensure patient consent processes are updated to reflect AI usage. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the rapid advancement of telehealth technologies with the existing regulatory landscape for patient data privacy and security, specifically under U.S. federal law. The introduction of AI-driven diagnostic tools in remote care settings introduces new complexities regarding data handling, consent, and potential biases, demanding a proactive and compliant approach to safeguard patient information and ensure equitable care delivery. Correct approach analysis. Adopting a phased implementation strategy that prioritizes robust data encryption, secure data transmission protocols, and comprehensive patient consent mechanisms aligns with the core principles of HIPAA, Health Insurance Portability and Accountability Act, and HITECH Act. This approach ensures that the organization remains compliant with regulations governing protected health information, PHI, while exploring the benefits of AI in telehealth. It demonstrates a commitment to patient privacy and security by building in safeguards from the outset, rather than attempting to retrofit them later. This proactive stance minimizes the risk of breaches and regulatory penalties. Incorrect approaches analysis. Implementing AI-driven diagnostic tools without first establishing clear data governance policies and ensuring compliance with HIPAA security rule would be a significant regulatory failure. This approach risks unauthorized access, disclosure, or alteration of CPHI, leading to severe penalties. Deploying AI tools without obtaining explicit, informed consent from patients regarding the use of their data by AI systems, especially for diagnostic purposes, violates patient autonomy and privacy rights, and potentially contravenes HIPAA privacy rule. Focusing solely on the technological capabilities of AI, without a thorough risk assessment of potential biases in diagnostic algorithms and their impact on different patient populations, would be an ethical and potentially regulatory failure. This could lead to disparities in care and violate principles of equitable access. Professional reasoning. Professionals should approach the integration of new telehealth technologies by first conducting a thorough regulatory impact assessment. This involves identifying all applicable federal and state laws, particularly HIPAA and its associated rules. A risk assessment should then be performed to understand potential vulnerabilities related to data security, privacy, and ethical considerations. Developing clear policies and procedures that address data handling, consent, and bias mitigation should precede any implementation. Finally, ongoing monitoring and auditing are crucial to ensure continued compliance and adapt to evolving regulations and technologies. Question 2. The audit findings indicate a potential discrepancy in the access logs for a specific patient's electronic health record, suggesting unauthorized viewing. As the HIM professional responsible for data integrity and patient privacy, what is the most appropriate immediate course of action? Option A. Advise the patient directly about the potential unauthorized access to their records. Option B. Instruct the IT department to immediately revoke all access privileges to the patient's record pending further review. Option C. Immediately report the potential discrepancy to the Office for Civil Rights (OCR) as a potential HIPAA breach. Option D. Initiate a detailed internal investigation involving the IT department and relevant supervisors to identify the source and scope of the discrepancy and to determine if any policies or regulations were violated. The correct answer is D. Initiate a detailed internal investigation involving the IT department and relevant supervisors to identify the source and scope of the discrepancy and to determine if any policies or regulations were violated. Explanation. Scenario analysis. This scenario presents a common ethical challenge in health information management, balancing the need for data integrity and security with the potential for unintended consequences when data is shared. The challenge lies in interpreting vague audit findings and determining the appropriate course of action without overstepping professional boundaries or violating patient privacy. The HIM professional must exercise sound judgment, considering the potential impact on patient care, organizational reputation, and legal compliance. Correct approach analysis. The correct approach involves a systematic and collaborative investigation. This demonstrates adherence to ethical principles of beneficence, acting in the best interest of patients and the organization, and non-maleficence, avoiding harm. By initiating a thorough review with relevant stakeholders, the HIM professional ensures that the audit findings are fully understood, potential root causes are identified, and appropriate corrective actions are developed. This aligns with the HIM professional's responsibility to maintain accurate and secure health information, as mandated by regulations such as HIPAA, Health Insurance Portability and Accountability Act, in the U.S., which emphasizes the importance of safeguarding protected health information, CPHI, and implementing robust data governance practices. This approach prioritizes a data-driven, evidence-based resolution. Incorrect approach is analysis. One incorrect approach involves immediately reporting the findings to external regulatory bodies without internal investigation. This is premature and potentially damaging. It bypasses the organization's internal processes for addressing issues and could lead to unnecessary scrutiny or penalties if the findings are misinterpreted or can be resolved internally. This fails to uphold the principle of organizational responsibility and could be seen as a breach of trust with the employer. Another incorrect approach is to dismiss the findings as minor without further investigation. This is a failure of due diligence and could lead to significant breaches of patient privacy or data integrity. It neglects the HIM professional's ethical obligation to ensure the accuracy and security of health information, potentially violating HIPAA security rule, which requires risk assessments and mitigation strategies. A third incorrect approach is to directly confront the individuals suspected of involvement without a formal investigation. This can lead to defensiveness, denial, and a breakdown of trust within the organization. It also risks making accusations without sufficient evidence, which can have serious professional and legal repercussions for both the accused and the accuser, and does not follow established protocols for addressing potential policy violations. Professional reasoning. When faced with ambiguous audit findings, a HIM professional should employ a structured decision-making process. First, gather all available information and clarify the scope and nature of the findings. Second, consult relevant organizational policies and procedures, as well as applicable regulations, e.g., HIPAA. Third, engage in open communication with appropriate internal stakeholders, such as the HIM director, compliance officer, or IT security team, to discuss the findings and potential implications. Fourth, develop and implement a plan for further investigation and remediation, ensuring that patient privacy and data security remain paramount. Finally, document all actions taken and decisions made. This methodical approach ensures that ethical obligations and regulatory requirements are met while protecting the integrity of health information and the organization. Question 3. Governance review demonstrates that a newly implemented system at a multi-specialty clinic is primarily used for managing patient demographics, scheduling appointments, generating bills, and tracking insurance claims. While it stores some basic patient contact information and visit dates, it does not contain detailed clinical notes, diagnostic results, or medication lists that are accessible across different departments or for continuity of care purposes. Based on its functionalities and scope, which of the following best describes this system within the context of U.S. healthcare information systems? Option A, Healthcare Information System, HIS. Option B, Electronic Medical Record, EMR. Option C, Practice Management System, PMS. Option D, Electronic Health Record, AIR. Correct answer is D, Electronic Health Record, AIR. Explanation. This scenario presents a common challenge in healthcare organizations: the need to select and implement information systems that align with strategic goals, regulatory requirements, and operational realities. The professional challenge lies in accurately distinguishing between different types of healthcare information systems and understanding their specific functionalities and intended uses. This requires a nuanced understanding of how these systems support patient care, administrative processes, and regulatory compliance within the U.S. healthcare landscape, specifically as it pertains to the Certified Professional in Healthcare Information (CPHI) exam scope. Careful judgment is required to avoid misclassification, which can lead to inefficient resource allocation, compliance issues, and suboptimal patient care. The correct approach represents best professional practice because it accurately identifies the system based on its core functionalities and intended scope of use. A system designed to manage a patient's comprehensive health record across multiple encounters and providers, facilitating continuity of care and meeting regulatory mandates like HIPAA, is fundamentally an electronic health record, AIR. This aligns with the CPHI focus on understanding systems that support the holistic management of patient health information. An incorrect approach would be to mischaracterize a system that primarily manages administrative and financial data as an EHR. For instance, classifying a system solely focused on appointment scheduling, billing, and basic demographic information as an EHR would be a regulatory and ethical failure. Such a system, while important, typically falls under the umbrella of a practice management system, PMS, or a broader healthcare information system, HIS, that may not encompass the full clinical data set required for an EHR. This misclassification could lead to the organization failing to implement a true EHR, thereby jeopardizing compliance with meaningful use, promoting interoperability programs, and potentially impacting the quality and continuity of patient care by not having a comprehensive clinical record. Another incorrect approach would be to label a system that only records data within a single practice or encounter as an EHR. This describes an electronic medical record, EMR, which is a subset of an EHR and does not inherently facilitate interoperability or longitudinal patient data management across different healthcare settings, a key characteristic of an EHR. This distinction is critical for regulatory compliance and effective data exchange. The professional reasoning process for similar situations should involve a systematic evaluation of the system's primary purpose, the scope of data it captures and manages, its intended users, and its role in supporting clinical decision-making and regulatory compliance. Professionals should ask, does this system capture comprehensive clinical data? Does it support longitudinal patient records? Is it designed for interoperability and data exchange? Does it facilitate clinical decision support? Answering these questions will help accurately categorize the system and ensure appropriate selection, implementation, and utilization, thereby upholding professional standards and regulatory obligations. Question 4. Implementation of a new electronic health record (AIR) system at a large multi-specialty clinic requires seamless data exchange with external laboratories, referring physicians, and a regional health information exchange (HI). The clinic must ensure that patient demographic information, clinical notes, medication lists, and laboratory results can be securely and accurately transmitted and received. Considering U.S. federal regulations and the need for broad interoperability, which approach best facilitates this requirement? Option A. Rely solely on HL7v2, X messaging for all data types, as it is a long-standing standard in healthcare. Option B. Utilize DICOM, digital imaging and communications in medicine, for all patient data, as it is a widely recognized healthcare standard for data transmission. Option C. Prioritize the implementation of FHIR, Fast Healthcare Interoperability Resources, APIs for all data exchange, ensuring adherence to ONC certification requirements for data access and exchange. Option D. Develop custom, proprietary data exchange protocols between the EHR and each external entity to ensure maximum control over data formatting. The correct answer is C. Prioritize the implementation of FHIR, fast healthcare interoperability resources, APIs for all data exchange, ensuring adherence to ONC certification requirements for data access and exchange. Explanation. This scenario presents a common challenge in healthcare IT, integrating disparate systems to improve patient care and operational efficiency. The professional challenge lies in selecting and implementing interoperability standards that not only meet technical requirements, but also comply with U.S. federal regulations, specifically those governing electronic health information exchange and patient privacy. The choice of standard directly impacts data security, accessibility, and the ability to share information across different healthcare providers and systems, all while adhering to the Health Insurance Portability and Accountability Act, HIPAA, and the Office of the National Coordinator for Health Information Technology, ONC, Health IT Certification Program. The correct approach prioritizes a standard that is widely adopted, robust, and specifically designed for healthcare data exchange, while also considering the regulatory landscape. FHIR, Fast Healthcare Interoperability Resources, is a modern standard that addresses many of the limitations of older standards and is increasingly mandated or recommended by U.S. regulations for its flexibility, ease of implementation, and focus on API-driven access, which aligns with the goals of promoting interoperability and patient access to their data. Its resource-based approach makes it adaptable to various use cases and data types, facilitating seamless data exchange. An incorrect approach might involve selecting a standard that is outdated or not designed for the specific type of data being exchanged. For instance, relying solely on DICOM for all patient data, when it is primarily for medical imaging, would be a significant failure. While DICOM is crucial for imaging, it does not encompass the full spectrum of clinical data like demographics, diagnoses, or medications. Another incorrect approach would be to implement a proprietary or non-standardized method of data exchange. This would create data silos, hinder interoperability with other systems, and likely violate HIPAA requirements for secure and standardized electronic exchange of health information. Furthermore, choosing a standard without considering its alignment with ONC certification criteria could lead to non-compliance and prevent the organization from participating in federal incentive programs or meeting regulatory mandates. A professional decision-making process should involve a thorough assessment of the organization's current and future interoperability needs, an understanding of the various healthcare data standards and their strengths, and a deep dive into the relevant U.S. federal regulations. This includes evaluating how each standard supports secure data transmission, patient privacy, and the ability to exchange data with a wide range of healthcare entities. A risk assessment should also be conducted to identify potential security vulnerabilities and compliance gaps associated with each chosen standard. Question 5. Stakeholder feedback indicates that the current security audit process for the healthcare organization's electronic health record, EHR, system is perceived as overly disruptive to clinical workflows, leading to staff frustration and concerns about potential impacts on patient care. The CPHI professional is tasked with recommending a revised approach to security audits and compliance assessments that addresses these concerns while ensuring robust data protection and adherence to relevant U.S. healthcare regulations. Which of the following approaches best balances operational needs with regulatory compliance? Option A. Implement a risk-based, phased audit strategy, prioritizing critical EHR modules and sensitive patient data for initial assessment, with ongoing, less intrusive monitoring for other areas. Option B. Outsource all security audit functions to a third-party vendor without establishing clear internal oversight or integration with existing compliance frameworks. Option C. Postpone all comprehensive security audits until the next scheduled system upgrade, relying solely on automated alerts for immediate security threats. Option D. Conduct a full, system-wide audit of all EHR functionalities and associated infrastructure during a designated low-activity period, even if it requires temporary suspension of certain non-critical clinical services. The correct answer is A. Implement a risk-based, phased audit strategy, prioritizing critical EHR modules and sensitive patient data for initial assessment, with ongoing, less intrusive monitoring for other areas. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the need for robust security audits with the practical constraints of ongoing healthcare operations. The CPHI professional must navigate potential disruptions to patient care and staff workflow while ensuring compliance with stringent healthcare data protection regulations. The pressure to demonstrate immediate compliance without compromising service delivery necessitates careful planning and risk assessment. Correct approach analysis. The correct approach involves a phased implementation of security audit protocols, prioritizing critical systems and sensitive data first. This aligns with the principle of risk-based security management, a cornerstone of healthcare information governance. By focusing on high-risk areas, the organization can achieve significant compliance improvements efficiently, minimizing disruption. This approach also demonstrates due diligence in protecting protected health information, CPHI, as mandated by regulations like HIPAA, Health Insurance Portability and Accountability Act, in the U.S., which requires covered entities to implement appropriate administrative, physical, and technical safeguards. Regular, documented reviews and adjustments based on audit findings are crucial for maintaining an effective security posture and demonstrating ongoing compliance. Incorrect approaches analysis. One incorrect approach involves conducting a comprehensive, system-wide audit immediately without regard for operational impact. This would likely lead to significant disruption of patient care, staff burnout, and potential breaches of patient privacy due to rushed or incomplete processes. Ethically, this approach fails to prioritize patient well-being and could violate the duty of care. From a regulatory standpoint, while comprehensive audits are necessary, a poorly executed, disruptive audit could inadvertently lead to non-compliance if critical systems are compromised or if patient care is negatively affected, which could be seen as a failure to implement reasonable safeguards. Another incorrect approach is to delay audits until a major security incident occurs. This is a reactive and highly risky strategy that directly contravenes the proactive requirements of healthcare security regulations. Regulations like HIPAA mandate ongoing risk analysis and management, not just post-incident responses. Waiting for breach demonstrates a severe lack of due diligence and ethical responsibility, exposing patients to significant harm and the organization to severe penalties, including substantial fines and reputational damage. A third incorrect approach is to rely solely on automated audit tools without human oversight and validation. While automation is valuable, it cannot fully capture the nuances of human behavior, policy adherence, or the context of specific clinical workflows. Over-reliance on automation without expert review can lead to missed vulnerabilities or false positives, creating a false sense of security and potentially failing to meet the comprehensive assessment requirements of regulatory frameworks. This approach can be seen as a failure to implement adequate technical and administrative safeguards, as it lacks the necessary human judgment and expertise to interpret audit results effectively within the healthcare context. Professional reasoning. Professionals should adopt a risk-based, phased approach to security audits. This involves 1. Identifying critical assets and sensitive data. 2. Prioritizing audit efforts based on risk levels and regulatory requirements. 3. Developing a phased implementation plan that minimizes disruption to patient care. 4. Ensuring adequate resources and expertise for audit execution and analysis. 5. Establishing a continuous monitoring and improvement process based on audit findings. This systematic approach ensures compliance, protects patient data, and maintains operational integrity. Question 6. The risk matrix shows a high likelihood of unauthorized access to patient demographic and billing information due to an outdated access control protocol. What is the most appropriate next step to ensure compliance with healthcare information security regulations? Option A. Immediately disable all access to the affected systems until a new protocol can be researched and implemented, regardless of operational impact. Option B. Initiate a comprehensive impact assessment to understand the potential consequences of unauthorized access on patient privacy and data integrity, and to inform the selection of appropriate mitigation strategies. Option C. Document the finding in the risk matrix and schedule a review of the protocol in the next annual security audit. Option D. Allocate budget for a new, state-of-the-art access control system without further analysis, assuming it will resolve the issue. The correct answer is B. Initiate a comprehensive impact assessment to understand the potential consequences of unauthorized access on patient privacy and data integrity, and to inform the selection of appropriate mitigation strategies. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare information systems, balancing the need for robust security measures with the operational requirements of patient care. The risk matrix highlights a potential vulnerability that, if exploited, could lead to a significant breach of protected health information. 5. The professional challenge lies in determining the most appropriate and compliant response to this identified risk, considering the potential impact on patient privacy, data integrity, and the organization's legal obligations under HIPAA. A hasty or ill-considered decision could result in regulatory penalties, loss of patient trust, and operational disruption. Correct approach analysis. The correct approach involves a comprehensive impact assessment. This aligns directly with the HIPAA security rules requirement for risk analysis and risk management. A thorough impact assessment would systematically evaluate the potential consequences of the identified vulnerability on the confidentiality, integrity, and availability of PHI. This includes understanding the scope of potential data exposure, the types of PHI at risk, and the potential harm to individuals. Based on this assessment, the organization can then implement appropriate safeguards, prioritizing those that offer the most effective mitigation for the highest risks, in accordance with HIPAA requirements for administrative, physical, and technical safeguards. This methodical approach ensures that decisions are data-driven, compliant, and proportionate to the identified risks. Incorrect approaches analysis. Ignoring the identified risk is a direct violation of HIPAA risk analysis and management requirements. The security rule mandates that covered entities conduct a thorough risk analysis to identify potential risks and vulnerabilities to the confidentiality, integrity, and availability of ePHI. Failing to address a known risk, especially one flagged on a risk matrix, demonstrates a lack of due diligence and can lead to significant penalties. Implementing a security measure without understanding its full impact is also problematic. While proactive security is important, implementing solutions without a proper impact assessment can lead to unintended consequences, such as disrupting critical healthcare workflows, creating new vulnerabilities, or incurring unnecessary costs. This approach lacks the systematic evaluation required by HIPAA to ensure that safeguards are appropriate and effective. Focusing solely on the cost of remediation without considering the potential impact of a breach is a failure to adhere to the principles of risk management. HIPAA emphasizes that risk management should be based on a thorough assessment of risks and vulnerabilities, not solely on the cost of mitigation. The potential costs of a data breach, including regulatory fines, legal fees, remediation efforts, and reputational damage, often far outweigh the cost of implementing appropriate safeguards. This approach prioritizes financial considerations over patient privacy and regulatory compliance. Professional reasoning. Healthcare information professionals must adopt a systematic and compliant approach to security and privacy. When faced with identified risks, the decision-making process should involve 1. Understanding the regulatory landscape. Familiarize yourself with HIPAA security rule, particularly the requirements for risk analysis and risk management. 2. Conducting a thorough risk assessment. Utilize tools like a risk matrix to identify vulnerabilities and potential threats. 3. Performing an impact assessment. Evaluate the potential consequences of a breach on PHI and individuals. 4. Developing and implementing a risk management plan. Prioritize mitigation strategies based on the assessed risks and their potential impact. 5. Documenting all actions. Maintain records of risk assessments, impact analyses, and implemented safeguards for compliance purposes. 6. Regularly reviewing and updating security measures. Security is an ongoing process, and periodic reviews are essential to adapt to evolving threats and technologies. Question 7. System analysis indicates that a healthcare organization is exploring the use of machine learning to predict patient readmission rates. To develop these models, the organization plans to access and analyze historical patient data, including demographic information, treatment histories, and medication records. Which of the following approaches best ensures compliance with U.S. healthcare regulation, specifically the Health Insurance Portability and Accountability Act, HIPAA, while enabling the effective use of predictive analytics? Option A. Utilize de-identified data for model development without conducting a formal risk assessment or establishing clear protocols for data handling, relying on the assumption that de-identification inherently eliminates all privacy concerns. Option B. Focus solely on the technical accuracy of the machine learning models, with minimal emphasis on data privacy and security protocols, as the primary goal is to achieve high predictive performance. Option C. Proceed with using raw patient data directly for model training, assuming that the predictive insights gained will inherently improve patient outcomes and thus justify the data usage under a broad interpretation of healthcare improvement. Option D. Implement a robust data governance framework that includes de-identification of patient data where feasible, strict access controls, comprehensive risk assessments, and ongoing security monitoring, while ensuring a valid legal basis for data use. The correct answer is D. Implement a robust data governance framework that includes de-identification of patient data where feasible, strict access controls, comprehensive risk assessments, and ongoing security monitoring, while ensuring a valid legal basis for data use. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent tension between leveraging advanced predictive analytics for improved patient care and the stringent regulatory requirements surrounding patient data privacy and security, specifically under U.S. HIPAA regulations. The use of machine learning models, while promising for identifying at-risk populations, necessitates careful consideration of how protected health information, CPHI, is accessed, processed, and secured to prevent breaches and ensure compliance. The complexity arises from the need to balance innovation with robust data governance and risk mitigation strategies. Correct approach analysis. The correct approach emphasizes a comprehensive risk assessment and mitigation strategy that aligns with HIPAA security rule and privacy rule. This involves identifying potential vulnerabilities in the data pipeline, from data acquisition to model deployment and ongoing monitoring. Implementing de-identification or anonymization techniques where appropriate, establishing strict access controls, and ensuring robust audit trails are critical. Furthermore, obtaining appropriate patient consent or ensuring a valid legal basis for data use, as well as conducting regular security audits and penetration testing, are essential to demonstrate due diligence and maintain compliance. This approach prioritizes patient privacy and data security while enabling the responsible use of predictive analytics. Incorrect approaches analysis. One incorrect approach involves deploying predictive models without a thorough assessment of data security risks and HIPAA compliance. Failure to conduct a risk analysis is a direct violation of the HIPAA security rule, which mandates such assessments. It exposes the organization to significant penalties and reputational damage. Another incorrect approach is to use de-identified data without verifying its adequacy for the intended purpose or without a clear understanding of re-identification risks, which can still lead to privacy violations if not handled correctly. A third incorrect approach is to bypass the need for patient consent or a valid legal basis for using CPHI in model training, which directly contravenes the HIPAA privacy rules requirements for permissible uses and disclosures of CPHI. Professional reasoning. Professionals in healthcare information must adopt a proactive and risk-aware approach when implementing predictive analytics. The decision-making process should begin with a clear understanding of the regulatory landscape, particularly HIPAA. This involves 1. Identifying the specific CPHI involved and its sensitivity. 2. Conducting a comprehensive risk assessment to identify potential threats and vulnerabilities. 3. Developing and implementing appropriate safeguards, technical, physical, and administrative, to mitigate identified risks. 4. Establishing clear policies and procedures for data access, use, and retention. 5. Ensuring ongoing monitoring and auditing of system performance and compliance. 6. Staying abreast of evolving regulatory guidance and technological advancements. This systematic approach ensures that innovation in healthcare analytics is pursued ethically and legally. Question 8. Investigation of a proposed new electronic health record, EHR system architecture, reveals a design that prioritizes rapid data integration from disparate legacy systems and immediate user access for clinical staff. However, the proposed architecture includes a centralized database with broad access privileges for system administrators and a less robust encryption strategy for data at rest to expedite the integration process. As a certified professional in healthcare information, CPHI, what is the most ethically and regulatorily sound approach to this situation, considering the requirements of the Health Insurance Portability and Accountability Act, HIPAA? Option A. Recommend the immediate implementation of the proposed architecture, with a plan to conduct a post-implementation security audit and implement necessary security patches and access control adjustments within the first 6 months. Option B. Advocate for a phased implementation of the EHR system, beginning with a core set of functionalities and a secure, granular access control model, while deferring less critical integrations until a more secure architectural framework can be established. Option C. Approve the proposed architecture as is, emphasizing that the immediate need for clinical access and data integration outweighs potential, albeit unlikely, security risks, and that security enhancements can be addressed in future updates. Option D. Propose a simplified data model that aggregates patient data without detailed patient identifiers, relying on a separate, secure system for re-identification to mitigate the risk of direct patient data exposure in the primary database. Correct answer is B. Advocate for a phased implementation of the EHR system, beginning with a core set of functionalities and a secure, granular access control model, while deferring less critical integrations until a more secure architectural framework can be established. Explanation. This scenario presents a significant ethical and professional challenge for a healthcare information professional. Core dilemma lies in balancing the immediate need for system functionality and data access with the long-term implications of architectural decisions that may compromise patient privacy and data security, potentially violating HIPAA regulations. The pressure to deliver a functional system quickly can lead to shortcuts that have serious repercussions. The correct approach prioritizes patient privacy and data security as foundational elements of system architecture, aligning with the spirit and letter of HIPAA. This involves a thorough risk assessment, adherence to the principle of least privilege, and robust data encryption and access controls from the outset. This proactive stance ensures compliance and builds trust, which are paramount in healthcare information management. An incorrect approach that overlooks the need for granular access controls and robust encryption, opting instead for a simpler, less secure design to expedite deployment, would violate HIPAA security rules. Specifically, it would fail to implement appropriate administrative, physical, and technical safeguards to protect electronic protected health information, (EPHI). This could lead to unauthorized access, disclosure, or breaches, resulting in significant penalties and reputational damage. Another incorrect approach might involve relying solely on vendor-provided security features without independent verification or customization to meet the specific needs of the organization, which also fails to meet the due diligence required by HIPAA. Finally, an approach that prioritizes system performance over data integrity and security without adequate safeguards risks data corruption or unauthorized modification, undermining patient care and violating HIPAA requirements for data integrity. Professionals should employ a decision-making framework that begins with a comprehensive understanding of applicable regulations, HIPAA in this case, followed by a thorough risk assessment of all proposed architectural designs. This assessment should consider potential threats to CPHI, vulnerabilities, and the likelihood and impact of breaches. Ethical considerations, such as patient trust and the duty to protect sensitive information, must be integrated into the decision-making process. Prioritizing compliance and security, even if it requires more time or resources upfront, is essential for long-term success and ethical practice. Question 9. What factors determine the ethical and legal permissibility of using de-identified patient data for clinical research informatics in the United States, specifically concerning the balance between research advancement and patient privacy? Option A. The consent of the principal investigator and the availability of advanced data analytics tools. Option B. The ease of re-identifying individuals from the de-identified dataset and the historical context of data collection. Option C. The perceived scientific value of the research and the researcher's professional reputation. Option D. The rigor of the de-identification process according to HIPAA standards and the approval of the research protocol by an institutional review board or privacy board. Correct answer is D. The rigor of the de-identification process according to HIPAA standards and the approval of the research protocol by an institutional review board or privacy board. Explanation. This scenario presents a professional challenge due to the inherent tension between advancing medical knowledge through clinical research and safeguarding the privacy and autonomy of research participants. The use of de-identified data in clinical research informatics is governed by strict regulations designed to protect individuals while enabling scientific progress. Careful judgment is required to balance these competing interests, ensuring that data is used ethically and legally. The correct approach prioritizes adherence to the Health Insurance Portability and Accountability Act, HIPAA, privacy rule, specifically its provisions regarding the use and disclosure of protected health information, CPHI, for research purposes. When data is de-identified according to HIPAA standards, either through a safe harbor method or expert determination, it is no longer considered CPHI and can be used for research without explicit patient authorization, provided the research protocol is approved by an institutional review board (IRB) or a privacy board. This approach represents best professional practice because it aligns with the legal and ethical framework for clinical research in the United States, ensuring that participant privacy is protected while facilitating valuable research. The IRB/privacy board review adds a crucial layer of oversight, confirming that the de-identification process is robust and that the research itself is ethically sound and scientifically valid. An incorrect approach would involve using data that has not been properly de-identified according to HIPAA standards, without obtaining patient authorization or a waiver from the IRB. This constitutes a direct violation of the HIPAA privacy rule, as it involves the unauthorized disclosure and use of CPHI. Such a failure exposes the organization to significant legal penalties, reputational damage, and erosion of public trust. Another incorrect approach would be to assume that any form of de-identification is sufficient, without verifying that it meets the specific requirements outlined in the HIPAA regulations. This oversight could lead to the inadvertent disclosure of identifiable information, even if the intent was to de-identify. A third incorrect approach might be to proceed with research using de-identified data without obtaining IRB or privacy board approval, even if the de-identification process is technically sound. While de-identified data is not CPHI, the research itself still requires ethical oversight to ensure participant welfare and scientific integrity. The professional reasoning process for similar situations should involve a systematic evaluation of the data's identifiability status in relation to applicable regulations. First, determine if the data contains any CPHI. If it does, assess whether it has been de-identified according to the specific standards of the relevant jurisdiction, in this case HIPAA. If de-identification is required, ensure the chosen method, safe harbor or expert determination, is correctly applied and documented. Concurrently, engage with the IRB or privacy board to review the research protocol, including the data handling and de-identification plan. This multifaceted approach ensures both legal compliance and ethical conduct in clinical research informatics. Question 10. When evaluating the potential use of patient data for a quality improvement initiative aimed at reducing hospital readmission rates, what is the most compliant and ethically sound approach under U.S. healthcare regulations? Option A. Limit the quality improvement initiative to only analyzing publicly available demographic data and general hospital admission statistics, as this completely avoids any potential privacy concerns related to patient health information. Option B. Utilize de-identified patient data that has undergone a rigorous de-identification process compliant with HIPAA standards, or obtain explicit patient authorization for the use of their identifiable data for this specific quality improvement purpose. Option C. Share the identifiable patient data with external research partners who have expressed interest in studying readmission rates, without obtaining patient consent or de-identifying the data, as this expands the potential for broader insights. Option D. Proceed with using identifiable patient data for the quality improvement initiative, assuming that any data used for internal quality improvement is implicitly permitted under HIPAA without further steps. Correct answer is B. Utilize de-identified patient data that has undergone a rigorous de-identification process compliant with HIPAA standards, or obtain explicit patient authorization for the use of their identifiable data for this specific quality improvement purpose. Explanation. This scenario is professionally challenging because it requires a healthcare organization to balance the imperative of patient privacy with the need for effective data analysis to improve care quality and operational efficiency. Navigating these competing interests demands a thorough understanding of the applicable regulatory landscape, specifically the Health Insurance Portability and Accountability Act, HIPAA, in the United States, which governs the privacy and security of protected health information, CPHI. The correct approach represents best professional practice because it prioritizes compliance with HIPAA privacy rule and security rule. By seeking de-identified data or obtaining patient authorization, the organization demonstrates a commitment to safeguarding PHI while still pursuing legitimate data analysis goals. This aligns with the ethical obligation to protect patient confidentiality and the legal requirements to prevent unauthorized disclosure of sensitive health information. An incorrect approach that involves using identifiable patient data without proper authorization or a valid HIPAA exception fails to meet the minimum legal and ethical standards. This constitutes a direct violation of HIPAA, potentially leading to significant penalties, reputational damage, and erosion of patient trust. Another incorrect approach, such as abandoning all data analysis efforts due to privacy concerns, is also professionally deficient as it hinders the organization's ability to improve patient outcomes and operational effectiveness, which is a core responsibility of healthcare professionals. Professionals should employ a decision-making framework that begins with identifying the specific regulatory requirements relevant to the task. This involves understanding the definitions of PHI, the permissible uses and disclosures, and the requirements for de-identification or patient consent. Next, they should assess the proposed data use against these regulations, considering potential risks and benefits. If direct use of identifiable data is contemplated, they must explore all available HIPAA exceptions or the necessity of obtaining patient authorization. When de-identification is an option, they should ensure the methodology used meets HIPAA standards. This systematic process ensures that data utilization is both effective and compliant, fostering a culture of responsible data stewardship. Question 11. The evaluation methodology shows that a new EHR system has been implemented and initial user training has been completed. To mitigate risks associated with user proficiency and potential data breaches, which of the following approaches best addresses the ongoing effectiveness of user training and support within the regulatory framework of HIPAA? Option A. Implement a support system that tracks user error rates and common support requests, using this data to provide targeted, ongoing retraining and individualized support based on observed performance and identified knowledge gaps. Option B. Conduct post-implementation surveys to gauge user satisfaction with the training and provide a general refresher course to all staff. Option C. Rely on the initial training completion records and offer a single, optional advanced training session for users who express interest. Option D. Focus on the number of technical support tickets resolved, assuming that a high resolution rate indicates effective user support and adequate training. The correct answer is B. Conduct post-implementation surveys to gauge user satisfaction with the training and provide a general refresher course to all staff. Explanation. The evaluation methodology shows a critical need to assess the effectiveness of user training and support for a new electronic health record (EHR) system implementation within a U.S. healthcare organization, adhering to HIPAA regulations. This scenario is professionally challenging because inadequate training and support can lead to user errors, compromised patient safety, data breaches, and non-compliance with federal regulations, all of which carry significant financial and reputational risks. Careful judgment is required to identify the most effective and compliant approach to risk mitigation. The correct approach represents best professional practice by directly linking training effectiveness to measurable outcomes and compliance, focusing on post-implementation support that includes ongoing feedback mechanisms and targeted retraining based on observed user performance, and error rates directly addresses the identified risks. This aligns with HIPAA security rule, which mandates that covered entities implement security awareness and training programs for all workforce members. By evaluating the impact of training on actual system use and error reduction, the organization can demonstrate due diligence in ensuring workforce competence and safeguarding protected health information. 5. This proactive, data-driven approach minimizes the likelihood of breaches and ensures the system is used safely and effectively, fulfilling ethical obligations to patients and regulatory requirements. An incorrect approach that relies solely on pre-implementation surveys for user confidence fails to capture real-world application challenges. This is a regulatory failure because it does not provide evidence of actual understanding or competency, nor does it identify specific areas where users struggle, potentially leading to ongoing errors and PHI compromise. Another incorrect approach, which involves only providing a generic one-time training session without follow-up or tailored support, is also a regulatory and ethical failure. HIPAA requires ongoing training and reinforcement. Without continuous support and adaptation to user needs, the effectiveness of the initial training diminishes, increasing the risk of non-compliance and data security incidents. A third incorrect approach, focusing solely on technical support tickets without analyzing the root causes of recurring issues, misses the opportunity to identify systemic training gaps. This can lead to a cycle of reactive problem-solving rather than proactive risk reduction, failing to meet the spirit of HIPAA requirement for a secure and well-managed information system. Professional decision-making in such situations requires a systematic risk assessment process. This involves identifying potential threats to patient safety and data security stemming from user interaction with the EHR, evaluating the likelihood and impact of these threats, and implementing controls. For user training and support, this means moving beyond simple attendance tracking to measuring actual competency, identifying knowledge gaps through observation and performance metrics, and providing targeted, ongoing support that adapts to evolving user needs and system functionalities. The goal is to ensure that all users can effectively and securely utilize the EHR to protect CPHI and deliver quality patient care, thereby meeting both regulatory mandates and ethical responsibilities. Question 12. Risk assessment procedures indicate that a healthcare organization is considering implementing a new remote patient monitoring (RPM) program utilizing wearable devices that transmit patient vital signs and activity data to a cloud-based platform for analysis by clinicians. Which of the following approaches best aligns with U.S. regulatory requirements for protecting patient health information in this context? Option A. Proceed with the RPM program by leveraging existing organizational security protocols, as these are generally sufficient to protect any data transmitted from remote devices. Option B. Conduct a comprehensive risk analysis to identify potential vulnerabilities in the RPM system, implement appropriate administrative, physical, and technical safeguards to mitigate identified risks, and ensure clear patient consent and education regarding data handling. Option C. Focus on the cost-effectiveness of the RPM devices and platform, with the understanding that regulatory compliance can be addressed as issues arise. Option D. Prioritize the selection of RPM devices and platforms that offer the most advanced data analytics capabilities, assuming that robust technological features inherently ensure compliance with HIPAA. The correct answer is D. Prioritize the selection of RPM devices and platforms that offer the most advanced data analytics capabilities, assuming that robust technological features inherently ensure compliance with HIPAA. Explanation. This scenario is professionally challenging because it requires balancing the benefits of innovative telemedicine and remote patient monitoring, RPM, technologies with the stringent privacy and security obligations mandated by U.S. healthcare regulations, specifically HIPAA. The core challenge lies in ensuring that the collection, transmission, and storage of protected health information, CPHI, via these technologies meet or exceed the standards set forth by the Health Insurance Portability and Accountability Act, HIPAA, Security Rule and Privacy Rule. Organizations must proactively identify and mitigate risks associated with data breaches, unauthorized access, and improper disclosure, especially when patient data is being transmitted and stored outside traditional, controlled environments. The correct approach represents best professional practice because it prioritizes a comprehensive, risk-based strategy that aligns with HIPAA requirements for safeguarding CPHI. This involves conducting a thorough risk analysis to identify potential vulnerabilities in the telemedicine and RPM systems, implementing appropriate administrative, physical, and technical safeguards to mitigate those risks, and establishing clear policies and procedures for data handling. This proactive and systematic approach ensures compliance with HIPAA mandates for confidentiality, integrity, and availability of CPHI, thereby protecting patient privacy and trust. An incorrect approach that focuses solely on the technological capabilities of telemedicine and RPM, without a robust risk assessment and mitigation plan, fails to address the fundamental HIPAA requirements. This could lead to regulatory violations, significant financial penalties, and reputational damage. Another incorrect approach that neglects to obtain explicit patient consent for the use of telemedicine and RPM, or fails to clearly communicate how their data will be used and protected, violates the HIPAA privacy rules provisions regarding patient rights and information access. Furthermore, an approach that assumes existing security measures are sufficient without a specific assessment of the unique risks posed by remote technologies overlooks the heightened vulnerabilities inherent in these systems, potentially leading to breaches and noncompliance. Professionals should employ a decision-making framework that begins with understanding the specific regulatory landscape, HIPAA in this U.S. context. This is followed by a thorough risk assessment of the proposed telemedicine and RPM solutions, identifying all potential threats and vulnerabilities to CPHI. Based on this assessment, appropriate safeguards, technical, physical, and administrative, must be selected and implemented. Ongoing monitoring, evaluation, and training are crucial to ensure continued compliance and adapt to evolving threats and technologies. Patient education and consent are also integral components of this framework. Question 13. The control framework reveals that a healthcare organization is seeking to optimize its data management strategy for improved clinical decision support and streamlined billing processes. The organization is considering how to best leverage standardized terminologies and coding systems, specifically ICD-10-CM/PCS, CPT, and SNOMED-CT, to achieve these dual objectives, which approach best aligns with regulatory requirements and professional best practices for maximizing data utility and ensuring compliance within the U.S. healthcare system. Option A. Focus exclusively on ICD-10-CM/PCS for all clinical data capture and reporting to ensure consistent diagnostic and procedural coding for billing. Option B. Prioritize the use of CPT codes for all clinical documentation, as they represent billable services and are widely recognized. Option C. Implement SNOMED-CT for granular clinical documentation and ICD-10-CM/PCS for billing and reimbursement reporting, while utilizing CPT codes for specific procedural billing. Option D. Develop and implement a proprietary, custom terminology system for clinical documentation to better suit the organization's unique needs, bypassing standardized systems. The correct answer is C. Implement SNOMED-CT for granular clinical documentation and ICD-10-CM/PCS for billing and reimbursement reporting, while utilizing CPT codes for specific procedural billing. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a healthcare organization to balance the need for accurate and consistent clinical data with the practicalities of implementing and maintaining complex standardized terminologies and coding systems. The pressure to reduce costs while ensuring compliance with evolving regulations and maintaining high-quality patient care creates a difficult environment for decision-making. The choice of which coding system to prioritize for a specific initiative directly impacts data integrity, interoperability, and reporting capabilities, all of which are critical for effective healthcare management and regulatory adherence. Correct approach analysis. Prioritizing SNOMED-CT for clinical documentation and ICD-10-CM/PCS for billing and reporting aligns with best professional practice and regulatory expectations within the U.S. healthcare landscape. SNOMED-CT is a comprehensive, clinically detailed terminology that supports granular documentation of patient conditions, procedures, and findings, facilitating clinical decision support, research, and quality measurement. ICD-10-CM/PCS, on the other hand, is the standard for diagnostic and procedural coding for reimbursement purposes, mandated by CMS. This dual approach ensures both clinical richness for internal use and operational efficiency for external reporting and billing, thereby supporting compliance with HIPAA requirements for standardized data and CMS's mandates for accurate billing. This strategy maximizes data utility for various purposes and supports interoperability initiatives. Incorrect approach is analysis. Focusing solely on ICD-10-CM/PCS for all data capture would lead to a loss of clinical detail necessary for robust quality improvement, research, and clinical decision support, failing to leverage the full potential of standardized terminologies for patient care enhancement. This approach would also not fully meet the spirit of comprehensive data standardization for all healthcare purposes. Prioritizing CPT codes exclusively for all clinical documentation would be a significant regulatory failure. CPT codes are primarily designed for reporting procedures and services for billing and reimbursement, not for comprehensive clinical diagnosis or detailed patient condition documentation. Relying solely on CPT would result in incomplete and inaccurate clinical records, hindering clinical analysis, and potentially leading to noncompliance with reporting requirements that necessitate diagnostic coding. Implementing a custom, non-standardized terminology system for clinical documentation would be a direct violation of HIPAA Security Rule and the HITECH Act, which promote the use of standardized terminologies to ensure data interoperability and exchange. This approach would create significant barriers to data sharing, reporting, and integration with other healthcare systems, leading to operational inefficiencies and potential penalties. Professional reasoning. Professionals should approach this by first understanding the distinct purposes of each standardized terminology and coding system. ICD-10-CM/PCS is for diagnosis and inpatient procedures for billing and statistics. CPT is for outpatient procedures and services for billing. SNOMED-CT is a comprehensive clinical terminology for detailed clinical documentation. The decision-making process should involve assessing the specific goals of the initiative, e.g., quality reporting, billing optimization, clinical research, interoperability. A multi-pronged strategy that leverages the strengths of each system for its intended purpose, while ensuring compliance with relevant regulations like HIPAA and CMS guidelines, represents the most effective and professionally sound approach. This involves collaboration between clinical, IT, and billing departments to ensure seamless integration and accurate data flow. Question 14. Quality control measures reveal a ransomware attack has encrypted critical patient data and potentially exfiltrated sensitive information. The IT security team has identified the initial point of infection and is working to isolate affected systems. What is the most appropriate immediate next step to manage this cybersecurity threat in compliance with U.S. healthcare regulations? Option A. Immediately pay the ransom demand to expedite the decryption of patient data and restore system functionality. Option B. Initiate a comprehensive impact assessment to determine the scope of the breach, identify affected data, and evaluate potential unauthorized access or disclosure, while simultaneously containing the threat. Option C. Focus exclusively on restoring all affected systems from the most recent clean backups without further investigation. Option D. Delay all external notifications to patients and regulatory bodies until the entire network is fully operational and all data is confirmed to be restored. Correct answer is B. Initiate a comprehensive impact assessment to determine the scope of the breach, identify affected data, and evaluate potential unauthorized access or disclosure while simultaneously containing the threat. Explanation. Scenario analysis. This scenario presents a significant challenge due to the potential for widespread disruption of patient care and the compromise of sensitive protected health information. 5. The rapid spread of ransomware necessitates immediate and decisive action to mitigate damage, restore operations, and comply with regulatory obligations. The dual threat of data encryption and potential exfiltration demands a comprehensive response that balances technical recovery with legal and ethical imperatives. Correct approach analysis. The correct approach prioritizes containment and assessment, aligning with best practices for incident response and regulatory compliance under HIPAA, Health Insurance Portability and Accountability Act. HIPAA security rule mandates that covered entities and business associates implement administrative, physical, and technical safeguards to protect the confidentiality, integrity, and availability of electronic PHI (EFI). A swift containment strategy involving network segmentation and isolation of affected systems is crucial to prevent further spread. Simultaneously, a thorough impact assessment, including identifying the scope of the breach, the types of data affected, and the potential for unauthorized access or disclosure, is essential for determining notification obligations under the HIPAA breach notification rule. This approach ensures that actions are taken in a structured, informed manner, minimizing further harm and laying the groundwork for compliant reporting and remediation. Incorrect approaches analysis. One incorrect approach involves immediately paying the ransom without a thorough assessment. This is a failure because it does not guarantee data recovery, may fund further criminal activity, and does not absolve the organization of its regulatory responsibilities under HIPAA. Paying the ransom can also be seen as a violation of ethical principles by supporting illicit activities. Furthermore, there is no guarantee that the decryption key will work or that the attackers will not exfiltrate data even after payment. Another incorrect approach is to focus solely on restoring from backups without first containing the threat. This risks reintroducing the malware into the network once backups are restored, leading to a recurrence of the incident. It also bypasses the critical step of assessing the full impact of the breach, which is necessary for determining notification requirements under HIPAA. A third incorrect approach is to delay reporting the incident to regulatory bodies and affected individuals until all systems are fully restored. This violates the HIPAA breach notification rule, which requires timely notification to individuals and the Department of Health and Human Services, HHS. Following a breach of unsecured PHI, delays can result in significant penalties and erode patient trust. Professional reasoning. Professionals facing such a crisis must adopt a structured incident response plan that is aligned with regulatory requirements. The decision-making process should involve 1. Activating the incident response team. 2. Containing the incident to prevent further spread. 3. Assessing the scope and impact of the breach, including data types and potential unauthorized access. 4. Consulting legal counsel and cybersecurity experts. 5. Developing a remediation plan, which may include restoring from backups, rebuilding systems, and implementing enhanced security measures. 6. Fulfilling all regulatory notification obligations in a timely manner. This systematic approach ensures that all critical aspects of the incident are addressed, from technical recovery to legal compliance and ethical considerations. Question 15. Market research demonstrates that a healthcare organization is experiencing an increase in reported instances of unauthorized access to electronic protected health information, E5. The IT security team is tasked with recommending improvements to the current access control and authentication mechanisms to mitigate these risks and ensure compliance with federal regulations. Considering the need for both security and operational efficiency, which of the following recommendations would best address the identified vulnerabilities? Option A. Implement a system that requires unique user identification for all access to ePHI, enforces strong password complexity and regular password changes, and utilizes role-based access control RBAC to grant permissions based on job function. This system will also include regular auditing of access logs. Option B. Mandate the use of easily guessable passwords and disable all password complexity requirements to improve user experience and reduce the frequency of password resets. Option C. Grant all employees with access to the network full read and write privileges to all patient records, regardless of their specific role or department, to ensure no legitimate access is ever blocked. Option D. Transition to a system where all clinical staff share a single set of login credentials for accessing the electronic health record (EHR) system to simplify access and reduce the burden of remembering multiple passwords. The correct answer is A. Implement a system that requires unique user identification for all access to ePHI, enforces strong password complexity and regular password changes, and utilizes role-based access control RBAC to grant permissions based on job function. This system will also include regular auditing of access logs. Explanation. This scenario presents a common challenge in healthcare information management, balancing the need for robust access control with the practicalities of user authentication in a dynamic environment. The professional challenge lies in ensuring that only authorized individuals can access protected health information, PHI, while also facilitating efficient workflows for legitimate users. Failure to implement appropriate access controls can lead to privacy breaches, regulatory violations, and erosion of patient trust. The correct approach emphasizes a layered security strategy that incorporates both strong authentication and granular access control mechanisms. This aligns with the principles of HIPAA, Health Insurance Portability and Accountability Act, and its security rule, which mandates administrative, physical, and technical safeguards to protect electronic PHI E5. Specifically, the requirement for unique user identification, strong passwords, and role-based access control RBAC directly addresses the need to prevent unauthorized access and ensure accountability. RBAC is crucial as it assigns permissions based on job function, minimizing the risk of overprivileged access. Regular audits of access logs further reinforce accountability and help detect suspicious activity, a key component of HIPAA risk analysis and management requirements. An incorrect approach that relies solely on shared credentials fails to meet the fundamental requirement of unique user identification mandated by HIPAA. This makes it impossible to track who accessed specific CPHI, thereby undermining accountability and hindering breach investigation. It also significantly increases the risk of unauthorized access, as a compromised shared password grants access to multiple individuals. Another incorrect approach that uses weak, easily guessable passwords or no password complexity requirements directly violates HIPAA technical safeguards. Such a practice makes CPHI vulnerable to brute force attacks and unauthorized disclosure. The lack of multi-factor authentication, MFA, further exacerbates this vulnerability, as a single compromised credential is sufficient for access. Finally, an approach that grants broad access to all users without considering their specific roles or responsibilities is a clear violation of the principle of least privilege, a cornerstone of effective access control, and a requirement implicitly supported by HIPAA emphasis on appropriate safeguards. This over-provisioning of access dramatically increases the attack surface and the likelihood of accidental or intentional misuse of CPHI. The professional reasoning process for such situations involves a thorough risk assessment, understanding the specific regulatory requirements, in this case, HIPAA, and implementing a defense-in-depth strategy. This includes identifying critical data assets, understanding potential threats and vulnerabilities, and selecting appropriate technical and administrative controls. Regular review and updates of access policies and controls are essential to adapt to evolving threats and organizational changes. Question 16. Process analysis reveals that a healthcare organization is considering a significant investment in a new cloud-based electronic health record (EHR) system to improve interoperability and patient engagement. The primary drivers for this decision are perceived cost savings and enhanced user experience. However, the IT security team has raised concerns about the vendor's data encryption protocols and the location of data storage, which are not fully aligned with the organization's current risk management framework. The organization's HIT Strategy Committee is tasked with recommending a course of action. Which of the following approaches best aligns with U.S. regulatory frameworks and professional best practices for managing health information technology strategy? Option A. Proceed with the EHR implementation, prioritizing the cost savings and user experience benefits, and address any identified security gaps through post-implementation remediation. Option B. Authorize the IT department to proceed with the EHR implementation, focusing on the technical integration aspects, and defer the detailed security and privacy review until after the system is fully operational. Option C. Delay the EHR implementation and conduct a comprehensive, independent security and privacy risk assessment of the proposed vendor and system, ensuring all HIPAA security rule requirements are met before proceeding. Option D. Negotiate a revised contract with the vendor that mandates specific security controls and data residency requirements, and then proceed with a pilot implementation in a single department to validate security and usability. The correct answer is A. Proceed with the EHR implementation, prioritizing the cost savings and user experience benefits, and address any identified security gaps through post-implementation remediation. Explanation. This scenario presents a common challenge in healthcare organizations, balancing the drive for technological advancement with the imperative of patient privacy and data security, all within the strict confines of U.S. healthcare regulations, primarily HIPAA. The professional challenge lies in strategically selecting HIT solutions that not only enhance care delivery and operational efficiency, but also demonstrably meet stringent compliance requirements. This requires a nuanced understanding of how different HIT strategies interact with protected health information, CPHI, and the associated legal and ethical obligations. The correct approach prioritizes a comprehensive risk assessment and a phased implementation strategy that integrates security and privacy by design. This aligns with the HIPAA security rules mandate for administrative, physical, and technical safeguards. By conducting thorough risk analyses, organizations can identify potential vulnerabilities before they are exploited, ensuring that chosen HIT solutions are inherently secure and compliant. A phased approach allows for iterative testing, validation, and adjustment, minimizing disruption and ensuring that each stage of implementation adheres to regulatory standards. This proactive and integrated methodology represents best professional practice, because it directly addresses the core principles of data protection and patient confidentiality mandated by HIPAA, fostering trust and mitigating legal and financial repercussions. An incorrect approach that focuses solely on cost reduction without a commensurate evaluation of security implications is professionally unacceptable. This failure directly contravenes HIPAA requirement for risk analysis and the implementation of appropriate safeguards. Such an approach creates a significant vulnerability for unauthorized access, use, or disclosure of CPHI, leading to potential breaches, substantial fines, and reputational damage. Another incorrect approach that bypasses the organization's established HIT governance and security review processes is also professionally unacceptable. This bypass undermines the structured framework designed to ensure compliance and mitigate risks. It ignores the collective expertise and oversight necessary to make informed decisions about HIT adoption, potentially leading to the selection of solutions that are not adequately secured or do not meet interoperability standards, thereby jeopardizing patient data and operational integrity. The professional reasoning process for similar situations should involve a systematic evaluation of proposed HIT strategies against regulatory requirements, organizational policies, and ethical considerations. This includes 1. Clearly defining the strategic objectives of the HIT initiative. 2. Conducting a thorough risk assessment specific to the proposed technology and its impact on CPHI. 3. Engaging relevant stakeholders, including IT security, legal counsel, and compliance officers. 4. Prioritizing solutions that incorporate security and privacy by design. 5. Developing a phased implementation plan with clear milestones and validation points. And 6. Establishing ongoing monitoring and auditing mechanisms to ensure continued compliance and effectiveness. Question 17. The assessment process reveals that a new evidence-based medicine guideline for managing a specific chronic condition has been published, recommending the collection of additional patient-reported outcome measures, PROM, and the integration of data from wearable devices. The informatics team is tasked with determining the most appropriate approach to incorporate these changes into the electronic health record (EHR) system, considering both the benefits of enhanced clinical decision-making and the regulatory requirements for patient data. Which of the following approaches best balances these considerations? Option A. Implement the collection of PROM through a separate, non-integrated system that is not directly linked to the EHR, to avoid any potential impact on the existing EHR's security and privacy protocols, even if this creates data silos and hinders comprehensive patient record management. Option B. Immediately proceed with integrating the new PROM and wearable device data into the EHR, prioritizing the rapid adoption of the evidence-based guideline to improve patient care, and address any potential data security or privacy concerns as they arise. Option C. Defer the integration of the new PROM and wearable device data until the EHR system can be completely re-architected to accommodate these new data types, ensuring a perfectly secure and compliant system from the outset, even if it significantly delays access to evidence-based care. Option D. Conduct a comprehensive risk assessment to identify potential vulnerabilities in data security, privacy, and system integrity associated with collecting and storing the new PROM and wearable device data. Develop and implement appropriate safeguards, including enhanced access controls, encryption, and patient consent mechanisms before full integration. The correct answer is D. Conduct a comprehensive risk assessment to identify potential vulnerabilities in data security, privacy, and system integrity associated with collecting and storing the new PROM and wearable device data. Develop and implement appropriate safeguards, including enhanced access controls, encryption, and patient consent mechanisms before full integration. Explanation. The assessment process reveals a common challenge in healthcare informatics, balancing the rapid integration of new evidence-based practices with the need for robust data integrity and patient privacy. This scenario is professionally challenging because it requires a nuanced understanding of how informatics systems can support, or inadvertently hinder, the adoption of evidence-based medicine (EBM), while adhering to strict regulatory requirements. The core tension lies in ensuring that the pursuit of improved patient care through EBM does not compromise the security and confidentiality of protected health information (PHI), as mandated by regulations like HIPAA in the U.S. The correct approach represents best professional practice because it prioritizes a systematic, risk-based methodology for evaluating and implementing new EBM guidelines within the existing informatics infrastructure. This involves a thorough assessment of how the proposed EBM changes will impact data collection, storage, access, and reporting. It necessitates engaging stakeholders, including clinicians, informaticists, and compliance officers, to identify potential vulnerabilities and develop mitigation strategies. This aligns with the principles of responsible data stewardship and the ethical imperative to protect patient privacy, as well as the regulatory requirements for data security and breach notification. An incorrect approach that focuses solely on the clinical benefits of the EBM without adequately considering the informatics and privacy implications would be professionally unacceptable. This failure would violate regulatory mandates by potentially exposing CPHI or creating systems that are not compliant with security standards. For instance, implementing a new EBM protocol that requires the collection of sensitive patient data without appropriate consent mechanisms or encryption would be a direct violation of privacy regulations. Another incorrect approach might be to delay implementation indefinitely due to perceived informatics challenges, thereby failing to provide patients with the most up-to-date, evidence-based care, which can also have ethical implications regarding patient well-being. The professional decision-making process for similar situations should involve a structured risk assessment framework. This framework should include 1. Identifying the EBM change and its informatics requirements. 2. Assessing potential risks to data security, privacy, and integrity. 3. Evaluating the likelihood and impact of these risks. 4. Developing and implementing control measures to mitigate identified risks. And 5. Establishing ongoing monitoring and evaluation processes. Collaboration among clinical, informatics, and compliance teams is crucial throughout this process to ensure a comprehensive and compliant integration of EBM into healthcare informatics systems. Question 18. The efficiency study reveals that the IT department's current risk assessment process for electronic protected health information, EPHI, is time-consuming and has not identified any major security incidents in the past 2 years. The department is considering streamlining the process by focusing only on the most frequently reported minor technical glitches and by prioritizing mitigation efforts for risks that require minimal immediate investment. What is the most appropriate approach to ensure compliance with federal healthcare regulations? Option A. Conduct a comprehensive risk analysis that identifies and evaluates potential risks and vulnerabilities to the confidentiality, integrity, and availability of CPHI, prioritizing remediation efforts based on the likelihood and impact of identified risks, and documenting the entire process. Option B. Prioritize the mitigation of risks that can be addressed with readily available internal resources and minimal budget expenditure, as this demonstrates immediate action and cost-effectiveness. Option C. Streamline the risk assessment by focusing exclusively on the top 5 most frequently reported minor technical glitches, as these represent the most common threats to system stability. Option D. Rely on anecdotal evidence from IT staff regarding perceived security weaknesses, and focus the risk assessment on areas where staff express the most concern, regardless of documented incident history. The correct answer is A. Conduct a comprehensive risk analysis that identifies and evaluates potential risks and vulnerabilities to the confidentiality, integrity, and availability of CPHI, prioritizing remediation efforts based on the likelihood and impact of identified risks, and documenting the entire process. Explanation. This scenario presents a common implementation challenge in healthcare compliance, balancing the need for robust risk assessment with the practical constraints of resource allocation and operational efficiency. The core difficulty lies in identifying and prioritizing risks that are both significant in their potential impact on patient privacy and data security, and feasible to address within the organization's current capabilities and budget. A superficial approach risks overlooking critical vulnerabilities, while an overly exhaustive one can lead to paralysis and wasted resources. The correct approach represents best professional practice because it aligns with the fundamental principles of risk management and regulatory compliance mandated by U.S. healthcare laws, specifically the Health Insurance Portability and Accountability Act, HIPAA, security rule. This rule requires covered entities to conduct a thorough risk analysis to identify potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information (CPHI). A systematic, evidence-based approach that prioritizes risks based on likelihood and impact, and then develops a remediation plan, is the most effective way to ensure compliance and protect patient data. This proactive strategy demonstrates due diligence and a commitment to safeguarding sensitive information, which is a core ethical and legal obligation. An incorrect approach that focuses solely on the most frequently occurring issues without considering their potential impact on CPHI fails to adequately address the spirit and letter of HIPAA. This could lead to overlooking rare but high-impact breaches, such as a ransomware attack on a critical system, which could have devastating consequences for patient care and privacy. Another incorrect approach, which prioritizes only those risks that are easiest to mitigate, ignores the principle of proportionality in risk management. Significant risks, even if they require more substantial investment, must be addressed. Failing to do so constitutes a regulatory failure by not implementing appropriate administrative, physical, and technical safeguards as required by HIPAA. An approach that relies on anecdotal evidence or the opinions of a few individuals, rather than a structured and documented risk assessment process, lacks the rigor necessary for compliance and can lead to biased or incomplete risk identification, thereby failing to meet the comprehensive requirements of a HIPAA risk analysis. Professionals should employ a decision-making framework that begins with understanding the regulatory requirements, HIPAA security rule. This is followed by a structured risk assessment methodology that includes identifying assets, CPHI, threats, vulnerabilities, and existing controls. Risks should then be analyzed and prioritized based on their likelihood and potential impact. Finally, a risk management plan should be developed, outlining strategies for mitigating, transferring, accepting, or avoiding identified risks, with clear timelines and assigned responsibilities. This systematic process ensures that resources are allocated effectively to address the most critical risks, thereby achieving compliance and protecting patient information. Question 19. The risk matrix shows a moderate to high risk associated with a specific electronic health record (EHR) alert that is frequently overridden by clinicians. Which of the following approaches best represents a quality improvement best practice for addressing this situation, aligning with regulatory expectations for patient safety? Option A. Conduct a root cause analysis to understand why the alert is being overridden. Develop evidence-based interventions to address the underlying issues, and pilot a revised alert system or workflow before full implementation. Option B. Immediately disable the alert to reduce clinician frustration and perceived workflow disruptions, assuming the overrides indicate the alert is not clinically relevant. Option C. Rely on the anecdotal feedback from a few senior clinicians who believe the alert is unnecessary and proceed with disabling it. Option D. Implement a mandatory training session for all clinicians on the importance of the alert, without investigating the reasons for the overrides or evaluating the alert's effectiveness. The correct answer is A. Conduct a root cause analysis to understand why the alert is being overridden, develop evidence-based interventions to address the underlying issues, and pilot a revised alert system or workflow before full implementation. Explanation. This scenario presents a common challenge in healthcare quality improvement, balancing the need for immediate action with the requirement for thorough, evidence-based decision-making, all within the framework of patient safety regulations. The risk matrix, a standard tool for prioritizing potential harms, highlights a moderate to high risk associated with a specific clinical process. The challenge lies in determining the most effective and compliant response. Correct approach represents best professional practice because it aligns with the core principles of quality improvement and patient safety, mandated by regulatory bodies, such as the Office of the National Coordinator for Health Information Technology (ONC) and the Centers for Medicare and Medicaid Services (CMS) in the U.S. Specifically, it emphasizes a systematic, data-driven approach to identifying root causes and implementing evidence-based interventions. This aligns with regulations requiring healthcare organizations to have robust quality assessment and performance improvement programs, often involving the use of health IT to monitor and improve care. The focus on root cause analysis, RCA, is a cornerstone of patient safety initiatives, aiming to understand systemic issues rather than just addressing symptoms. Implementing a pilot program before full rollout allows for controlled evaluation and refinement, minimizing unintended consequences and ensuring the intervention is effective and safe. This iterative process is crucial for demonstrating due diligence and compliance with patient safety standards. An incorrect approach that focuses solely on immediate, unverified changes fails to adhere to the principles of evidence-based practice and may introduce new risks. Such an approach could violate regulations requiring documented quality improvement processes and a systematic approach to patient safety. It bypasses the critical step of understanding the underlying causes of the identified risk, potentially leading to ineffective or even harmful interventions. Another incorrect approach that relies on anecdotal evidence or the opinions of a few individuals without systematic data collection or analysis is also professionally unacceptable. This disregards the regulatory emphasis on data-driven decision-making and objective performance measurement. It can lead to biased interventions that do not address the true nature of the problem and may not achieve the desired safety outcomes. A third incorrect approach that involves implementing a solution without any form of evaluation or monitoring is equally flawed. This fails to demonstrate accountability and the commitment to continuous improvement required by regulatory frameworks. Without evaluation, it is impossible to determine if the intervention was successful, if it introduced new risks, or if further adjustments are needed, thereby undermining the entire quality improvement process. The professional reasoning process for navigating such situations involves a structured approach. 1. Acknowledge and validate the risk identified by the risk matrix. 2. Initiate a formal quality improvement process, which typically includes forming a multidisciplinary team. 3. Conduct a thorough root cause analysis to understand the contributing factors. 4. Research and identify evidence-based interventions or best practices relevant to the identified root causes. 5. Develop a plan for implementing the chosen intervention, including a pilot phase if appropriate with clear metrics for success. 6. Implement the intervention, collect data, and evaluate its effectiveness and impact on patient safety. 7. Make necessary adjustments based on the evaluation findings and disseminate lessons learned. This systematic, data-driven, and iterative approach ensures that interventions are safe, effective, and compliant with healthcare regulations. Question 20. Operational review demonstrates that a widely implemented clinical decision support system, CDSS, appears to be providing recommendations that, when analyzed across demographic subgroups, suggest a pattern of potentially less aggressive treatment suggestion for certain patient populations compared to others. This raises concerns about equity and potential bias within the system's algorithms. As a certified professional in healthcare information, CPHI, what is the most appropriate immediate course of action? Option A. Implement a manual override process for clinicians to disregard CDSS recommendations for patients belonging to the identified demographic subgroups, documenting each override. Option B. Immediately disable the CDSS for all users to prevent any further potential for biased recommendations until a full investigation can be completed. Option C. Accept the vendor's assurance that the system has undergone rigorous testing and is compliant with all relevant standards, and continue its use as is. Option D. Initiate a comprehensive audit of the CDSS algorithms and data inputs, specifically examining for bias and its impact on patient care recommendations across all demographic groups, while simultaneously engaging with the vendor for technical insights and potential remediation strategies. The correct answer is D. Initiate a comprehensive audit of the CDSS algorithms and data inputs, specifically examining for bias and its impact on patient care recommendations across all demographic groups, while simultaneously engaging with the vendor for technical insights and potential remediation strategies. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a direct conflict between the perceived efficiency of a clinical decision support system, CDSS, and the potential for it to introduce bias, leading to inequitable patient care. The CPHI professional is tasked with ensuring that technology supports, rather than hinders, ethical and compliant healthcare delivery. The challenge lies in balancing the benefits of technological advancement with the fundamental ethical obligation to provide unbiased, patient-centered care, all while adhering to specific regulatory frameworks. Correct approach analysis. The correct approach prioritizes a thorough, evidence-based review of the CDSS performance and its potential impact on patient outcomes, specifically looking for disparities. This aligns with the core principles of healthcare ethics, such as beneficence, acting in the patient's best interest and justice, fair distribution of resources and care. From a regulatory standpoint, this proactive investigation is crucial for compliance with regulations that mandate equitable access to care and prohibit discrimination. It also supports the principles of data integrity and system validation, ensuring that the technology used in patient care is reliable and does not introduce unintended harm. This approach demonstrates a commitment to patient safety and quality improvement, which are paramount in healthcare information management. Incorrect approaches analysis. One incorrect approach involves immediately disabling the CDSS without a comprehensive understanding of the issue. This is professionally unacceptable because it bypasses the opportunity to identify and rectify the root cause of the potential bias. It could lead to a loss of valuable clinical support for other patient populations and fails to address the underlying problem, potentially allowing it to resurface in other systems or processes. Ethically, it is a failure to diligently investigate and resolve a patient care concern. Another incorrect approach is to rely solely on the vendor's assurance that the system is unbiased, without independent verification. This abdicates professional responsibility and fails to uphold the duty of due diligence. Regulatory frameworks often require healthcare organizations to validate the systems they implement, especially those impacting clinical decisions. Trusting external assurances without internal validation can lead to continued noncompliance and patient harm if the vendor's assessment is flawed or incomplete. A third incorrect approach is to implement a workaround that manually overrides the CDSS recommendations for specific patient groups without a clear, documented, and evidence-based rationale. While seemingly addressing the immediate concern, this can introduce new inconsistencies, increase the risk of human error, and create a fragmented care process. It also fails to address the systemic issue within the CDSS itself, potentially leading to a patchwork of suboptimal care rather than a robust, equitable solution. Ethically, it can lead to inconsistent treatment and a lack of transparency in care delivery. Professional reasoning. Professionals in healthcare information should adopt a systematic, evidence-based approach to evaluating technology. This involves 1. Identifying the concern through operational review or patient feedback. 2. Conducting a thorough, objective investigation to understand the nature and extent of the issue, including data analysis for potential bias. 3. Consulting relevant stakeholders, including clinical staff, IT, and compliance officers. 4. Developing and implementing a remediation plan based on findings, which may involve system adjustments, retraining, or vendor engagement. 5. Continuously monitoring the system's performance post-remediation to ensure effectiveness and prevent recurrence. This structured process ensures that decisions are data-driven, ethically sound, and compliant with all applicable regulations.